Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, diabetes is a common condition that affects people of all ages. There are several forms of diabetes. Well, we will talk about the types of diabetes as well. A combination of treatment strategies can help you manage the condition to live a healthy life and prevent complications. So, to discuss on the topic, we have with us today Dr. Pranab Pathak, consultant diabetologist from Nemcare Hospital. So, not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. Well, thank you so much, Doctor, for joining to Good Life, the health show. So, today the topic which we have taken is a talk of the town, and we can say that one or the other person at every household is being suffering with diabetes. Now, if we talk about the general term, what is diabetes, if we want to make our viewers understand about it?
Diabetes is basically a metabolic disorder in which there is derangement of carbohydrate, protein and fat metabolism resulting mainly from hyperglycemia. Now, to diagnose a patient to have diabetes, either there should be a defect in the insulin secretion or insulin action or both.
Okay.
Patient needs to do a fasting blood glucose level. If it's more than or equal to 126, or a 2-hour blood glucose level if it's more than or equal to 200 mg per dl, or if the 3 months average is, which we call as glycosylated hemoglobin or HbA1c, if it is more than or equal to 6.5, then we label the patient to be suffering from diabetes. But in layman terms, diabetes means sugars above the normal.
Above the normal. Now, if you talk about, there must be some types of diabetes as well, so we will talk on that. Now, there are a notion among people that if we have a proper checkup on diabetes, a proper diagnosis is very important. Now, if a person is pre-diabetic, doctor, we'll ask about that. What is the term, and how much is the person said about pre-diabetic? So, what do you have to say on that?
Yeah, pre-diabetes is something which we really need to give importance, because these are the group of patients in whom, if they don't adopt any lifestyle change, or if they don't change the pattern of their eating habits, in very near future they are going to develop full-blown diabetes.
Okay.
Now, for a person to be labeled as pre-diabetes, his blood sugar level should be above the normal, but it should not be above the range to be labeled as diabetes. So, in other words, you can call it as a borderline diabetes.
Okay, okay.
So, mainly the reasons attributed for pre-diabetes is increasing level of stress, unhealthy lifestyle, then maybe family history of diabetes or genetic component can also be taken into consideration. So, we have to advise them to go for regular monitoring of the blood sugars, and at the same time they need to consult their physician, because sometimes along with diet and exercise, medications may also be required to prevent these category of pre-diabetic patients getting transformed to diabetes.
Okay.
So,
if you want to know about the level, doctor, what would be that for the pre-diabetic?
For a patient to be pre-diabetic, his fasting should be between 100 to 125. As I've said, that for a patient to be labeled as diabetes, it should be 126 or above.
Okay.
For pre-diabetic patients, the fasting blood glucose has to be between 100 to 125, and the 2-hour postprandial blood sugar value has to be between 140 to 199. Once he crosses 199, that is 200 or above, he falls in a diabetic category.
Okay.
So, in a nutshell, it is these category of pre-diabetic patients who needs more frequent monitoring than the diabetic patients,
Okay.
so that they don't develop diabetes in near future.
Because the ones who are already with the diabetes, they are taking medicines,
Yeah,
they're
they'll be
having their
extra cautious.
precautions.
They'll be taking
But about the
precautions.
pre-diabetics, they have to have a proper check, and if need be, to see a physician as early as possible.
That is very much
now,
required.
Yeah. So, if we talk about the types of diabetes, doctor, what are those?
Basically, we have two types of diabetes, that is known as type 1 diabetes, which usually occurs in the children. In type 1 diabetes, the body doesn't produce insulin or produces very less amount of insulin. This is basically seen in the children. Then there is one more type of diabetes which is more common, encompassing around 90% of the diabetes that we see in our day-to-day clinical practice, which is known as type 2 diabetes, where the body produces insulin, but that insulin is not very functional. There is a component of defect in insulin secretion as well as insulin resistance. So, these are the kind of patients who will be requiring either tablets or insulin. And there is one more type of diabetes, which is a transient form of diabetes, which is known as gestational diabetes. This is seen mostly in women, especially during their pregnancy. In the later half of the pregnancy, the sugars go up. So, this is known as gestational diabetes. But amongst these, the commonest is the type 2 diabetes, which we get very
type 2 diabetes
common in our day-to-day clinical practice.
Okay. Now, we had an idea about what could be the causes of diabetes. Now, doctor, if we want to know about the basic causes of diabetes, what would be that?
See, diabetes is basically a metabolic disorder. So, the most important causes which are responsible for diabetes is unhealthy lifestyle, sedentary lifestyle, lack of physical activity, patients who are not taking their diet properly, patients who are doing less amount of physical activity, patients who have a family history of diabetes, genetic component also cannot be denied. Then also patients who are having some risk factors such as hypertension, those who are obese or overweight, those who have dyslipidemia, whose cholesterol is on the higher side, those who have history of smoking, history of excessive alcohol consumption. So, all these risk factors ultimately leads to the development of diabetes if the patient is not aware of or do not try to reduce these risk factors. So, these are some of the common causes which are attributed to diabetes.
Okay. Now, is there a particular age group we are talking about, doctor? Nowadays, we see that a kid is also diagnosed with diabetes. So, is there a particular age group in your
That's a very
profession?
good question. To be honest, there is no age bar for diabetes. Diabetes can happen to anyone, whether it is a one-day child or whether it is a 70 or 80-year-old human being. Anybody can get diabetes. The thing is that if what we commonly see in our clinical practice is that if diabetes occurs in children or if it occurs in the younger age group, it is basically type 1. But if it occurs in the adult population, it's basically type 2. But but that is not the rule of thumb. Sometimes even we may get type 1 diabetes in older patients. Age is no more a criteria for development of diabetes. As I have said, it can occur in any age. Genetic component, because different patients have different genetic makeup, the body structure is different, so diabetes can occur at any age. But there are some special tests which will help us to understand whether the patient is having type 1 diabetes or type 2 diabetes, because the treatment modalities will vary according to the type of diabetes.
All right, viewers, so numbers are flashed on your television screen. So if you have any queries regarding the topic diabetes, so please call up and ask a question. Dr. Pranab Pathak is with us to give you all the answers. Now, doctor, coming back to you again, now we had an idea about the types of diabetes, now talking about the causes of diabetes. Now, if we talk about that, when is the right time to see a healthcare professional? When is the right time to see a physician? Like one should not avoid things and go very late to a physician, isn't it, doctor?
Yeah, that is very true. The interesting story is that many a times diabetic patients may not manifest any signs and symptoms. Not all patients who have diabetes do have symptoms. There are some patients who come to us and they do a routine blood test, and it is only when they do the blood test then their figure shows that they have diabetes. But if you have any such symptoms such as increased urination, increased hunger, increased thirst, then I think it's an alarming sign that you need to consult your physician. Again, as I've said, that sometimes there may not be any signs and symptoms, but if you have a strong family history of diabetes, say for example your parents are diabetic or your siblings are diabetes, or there is any first degree relative who is suffering from diabetes, you are overweight, you are obese, you have history of hypertension, then I think periodic checkup or consultation with the doctor can help you to diagnose whether you have diabetes or not, so that you don't land up with complications later on.
All right, doctor, we'll have more conversation, but right now we'll take a break. All right, viewers, will slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja, and we are having a fruitful discussion on the topic diabetes. Now, doctor, coming back to you again. Now, we already mentioned about that when is the right time to see a professional. So, when a patient comes to your hospital, so what is the diagnosis part? What is the first thing is being done to the patient? Of course, you take the history. Is there a person who is already suffering from diabetes in your family? Then the diagnosis part comes. So, what is being done on that?
So, whenever any patient walks to a clinic or a hospital to evaluate whether he or she has diabetes or not, as you have said, we always take a detailed history. That not only includes his symptoms, but at the same time we also try to evaluate whether he has any family history of diabetes, how is his lifestyle, his level of physical activity, whether he takes nutritious food or he is taking more of a junk food or not, history of smoking, alcohol. So, all these we have to keep in mind. Then we do a routine checkup regarding his weight, regarding his height, because we also have to assess whether he is overweight, obese or not. At the same time, we advise him some basic tests which needs to be done, such as the fasting blood glucose level, the postprandial blood glucose level, the 3 months blood sugar average, including the cholesterol, as well as a routine eye checkup, because diabetes is not only about treating the blood sugar level, we also have to keep in mind the other organs of the body, because at the end of the day we have to prevent target organ damage, and diabetes, as I have said, can affect any organ of the body. Right from head to toe. So, we do a general checkup including the whole body, and we also try to look for development of complications, because many a times there may be some subtle complications which the patient may not perceive and may not notice, including the feet.
Okay.
So, a detailed history and a proper medical examination is done, including the routine tests which we advise to the patients. Based on these, we can come to a clinical diagnosis as to whether he is suffering or not, and then we counsel him about diet and medications if required, and he needs to be on constant follow-up. That is
all right.
important.
Now, doctor, diet also plays an important role. So, if we talk about the diet part, so what would you like to say on that?
Diet, in fact, plays a very important role in diabetes management. It is actually a very strong pillar for diabetes management, and in a country like India, or for that matter South Asian countries, are more prone for taking high amount of carbohydrates. So, we have to advise our patient to reduce the amount of carbohydrate which they take, and at the same time we also have to make them understand that they have to take a balanced diet containing appropriate amount of carbohydrates, vitamins and proteins. Protein intake, of course, I think is very less in this part of the world, and at the same time there are also people who take more of junk food, more of trans fat, which can be very deleterious. So, we have to counsel them, and if required, we have to advise them to take help of a dietitian who can give them a customized diet chart based on their body weight, based on the type of disease they are suffering, and at the same time we also have to keep in mind their likes and dislikes. We cannot force one particular diet to one particular person. We also always have to keep in mind what is his likes, what is his dislikes, and the total calorie intake has to be measured, and this is why precision diabetes will come into play, where every patient is different. You cannot give a generalized diet chart to each and every one, because his way of living is different, his level of physical activity is different, his lifestyle is different, his immunity is different, his walking style, his
so every patient has its own diet chart.
Own diet chart, the customized diet chart, and we count the total amount of calories which he or she requires, and based on which we can give him an idea that these are the kind of food which you can take easily, these are the kind of foods which you can take in moderation, and these are the kind of food which you need to avoid. But honestly speaking, carbohydrate intake is very high in this part of the country, and we really advise our patients to reduce the carbs, which can be very effective. At the same time, there are some patients who also follow very erratic diets, maybe some diets which they will not be able to continue for a long time. So, we have to advise our patients to go for those kind of diet which they can sustain for a long time. At the same time, they also enjoy eating, because at the end of the day you have to enjoy what you eat.
Okay. Now, doctor, when the treatment procedure starts on a diabetic patient, so side by side, of course, you give a diet chart also, and a dietitian is being asked to recommend what things to be taken and what not to be taken. Now, if we talk about that, how exercise also plays an important role in controlling diabetes. So, what do you have to say on that?
Yes. Physical activity or regular physical exercise is very much important for diabetic patients. This not only helps in reducing your blood sugars, at the same time it also helps in reducing your blood pressure and keeps your cholesterol under check. So, this is very much required. Textbook recommends that 30 minutes per day for 5 days a week, or roughly say 150 minutes per week of moderate intensity exercise is usually advised for most of the patients. They can even go for increasing the duration of exercise. But what is important is that they need to do it on a constant basis, and they should do it periodically. It's not that on one particular day you do 150 minutes of exercise and rest 6 days a week you do not do exercise.
Because aggressive exercise is also not recommended.
Yes, aggressive exercise is also not recommended. You have to take, you need to follow your physician's advice, and you need to do that much amount of exercise which your body permits. But what is important is that with any form of exercise, whether it is walking, running, skipping, jumping, whatever the patient feels like, or some patients can even do treadmill in their home. Some patients can go and hit the gym. So the level of physical activity have to be decided, and the consistency of physical activity has to be done if you need to reduce the diabetes as well as other metabolic disorders.
Okay. Now, doctor, there must be some complications also which is seen in the diabetic patients, so which is mostly seen usually. So what are those complications, doctor?
Not all persons suffering with diabetes will end up with complications. Eventually, if we see or if we assess, it is seen that complications are more common in those category of patients in whom the blood sugar levels remains persistently high. That is, their fasting is higher than the normal, or their 2 hours blood glucose is higher, or HbA1c, which we know there's the 3 months blood glucose level, it invariably remains above 7 or 8. It's not under control. So those category of patients where the blood sugar is not under control, they may suffer from complications. Now, complications again can be divided into two categories, microvascular as well as macrovascular. Regarding microvascular complications, it can affect the small blood vessels and it can affect the organs such as the kidneys. The patients may have nephropathy, then it can affect the eyes, patient may have retinopathy, and it can also affect the nerves, where the patient may complain of tingling sensation, burning sensation, or sometimes even loss of sensation in the feet, which is known as diabetic neuropathy. So these are some of the microvascular complications which may arise as a result of uncontrolled blood sugars. Again, there are some patients who may also develop macrovascular complications, and amongst these the most commonest is the coronary artery disease or the heart disease. Patients may suffer from heart attacks, patient may suffer from stroke, patient may suffer from peripheral vascular disease, and there is one more important complication which patients may develop as a result of uncontrolled diabetes is non-healing ulcers. That is why I usually recommend most of my patients to take good care of their feet. So these are some complications which can develop, not all of them, but those patients who have diabetes for longer duration of time and that to uncontrolled diabetes can eventually end up for complications, and that is why screening of these complications is very much required whenever they come for checkup.
Okay. Now, there is also consultations and also, of course, you again have to go for a re-checkup as well. So many people avoid those things. And if we talk about the medicines which already has been prescribed by the physician, and in between, if their diabetes is under control and they stop in between the medicine, so what do you have to say to those patients?
Yeah, that is one of the problems which we have been tackling and we have been dealing with, or we do get frequently such kind of patients where they take their medicines correctly, and once their sugars are under control, they either try to reduce the medicines by themselves or sometimes they even stop their medicines. What is very important is that these patients should come for periodic checkup. It is not that you have given one prescription which they will continue for 5 years or 10 years down the line, because your body will keep on changing, your food habits may change. So when a doctor gives a prescription to one particular patient, that prescription is for that particular period of time. The patient needs to follow the prescription, needs to follow the medication and also follow the dietary advice. But after 3 months or say 6 months, whenever the doctor advises to come for re-checkup, I think the patient should come and they should re-evaluate their blood parameters and do regular consultation, because certain modifications in the medications may be required which the patient will not be able to do. That can be done only by a trained doctor. So this is why we always advise our patients to be in constant touch. Sometimes, of course, if the patient is not able to come physically, now in an era of digitalization, you can be in touch with your physician through digitalization mode, through emails or through WhatsApp, whatever form of digitalization mode is there. But you need to be in constant touch with your physician at regular intervals, because this not only helps the doctor, but it also helps the patient, because he understands how his disease is progressing, and thereby necessary modifications in the treatment profile can be made accordingly.
So when the patient goes for the re-checkup, again the same procedure is being applied on him, the diagnosis part or the whatever the modalities is being done?
Not exactly. We usually do not repeat all the tests. It's only when the patient comes for the first time we do a periodic checkup and we try to evaluate the patient's history, and then we get an idea as to what kind of disease he is suffering or whether there is any particular complications or not. And on subsequent visits, there are some special tests which the patient needs to do, and based on the patient's profile, we will evaluate them and we will advise them some special tests which they can do, and based on the results we will make necessary modifications in the treatment plan. Sometimes of course the same prescription may continue or may be required to continue, but it's not that you will do all the tests or you will repeat everything just as the first visit. The subsequent visits, usually the number of tests decreases. Sometimes again new modalities of prescriptions may be given, or some new tests may be required if the patient complains of some new symptoms. So this again will depend from patient to patient, how he feels, how he's responding to treatment. The response to treatment
depending on the
has to be
condition
analyzed.
of the patient,
Yes.
everything
the response
depends
to
on.
treatment has to be analyzed and necessary modifications have to be made. That is why the patient has to come for checkup.
Now, doctor, we have seen nowadays, because of the lifestyle, obesity and these overweight is also on the rise. Now, is it something to do with the diabetes also, doctor?
Yes, I think there's a very strong relation between obesity and diabetes. It's more common now because of our lack of physical activity, sedentary lifestyle, and I think this obesity is to some extent increasing in the children also. Previously, most of the children were playing outdoor games. Now they are more concerned on video games or using electronic gadgets. So I think the level of physical activity has decreased. And also I think during COVID time, because of the restrictions, people were not hitting the gym or they were not doing regular physical
activities.
So there, plus I think when they were in their home, I think there was increased snacking. That also may be an important factor contributing to obesity. But that's a chapter which is gone. But still the obesity is increasing. It's also increasing in the children, and it's basically because of sedentary lifestyle. We have to advise our patients to go for some amount of regular physical activity, and children should engage in some amount of sports or physical activity which will help them to keep their body weight under control, and this will not only help them to prevent from diabetes, it will also prevent them from developing blood pressure, increased cholesterol, and they can other cardiovascular disease can also be prevented if we try to cut down the weight. So obesity is one more important aspect which needs. Diabetes has very strong relation with obesity. That is why there is one term which is known as diabesity, combination of diabetes and obesity.
Diabesity.
So those patients who are obese, they are at high risk of developing diabetes. Same vice versa, those patients who are diabetes are also at high risk of developing obesity. Not all patients who are diabetes will develop obesity, but again this also depends on the gene, but there is definitely a strong component of relationship between diabetes and obesity. That is why we advise our patients to regularly monitor their weight and try to reduce their weight and keep it under control.
Okay. Now, doctor, medicines will do its job, but so is there any home remedies that person can apply at home immediately, and then of course they'll have to go to see a physician? What do you have to say regarding diabetes? Like if they find out any signs and symptoms, and if they initially want to do something at home itself and then go to see a physician, we have seen a lot of people, they immediately don't go for any test or want to do things at home itself, like taking up some home remedies as well.
Yeah, the home remedies can be taken, but I still feel that once you develop any signs and symptoms, or once you have a strong family history, though you take the home remedies, I think it is always advisable to consult your physician as early as possible, because sometimes some complications may develop, you may not be aware of it, and if you're diagnosed late, then it may cause even more harm. So my sincere advice is that if you notice any signs and symptoms, it is advisable that you consult your physician regularly. You may not require any medication, but he'll definitely advise you to adopt some healthy lifestyle, which you need to follow on a regular basis.
At least the things will be clear. And
things will be clear. You can get a clear picture as to how your body is responding, and maybe you need to do some tests so as to prevent some other disease.
Okay. All right. Thank you so much, doctor. So one last message, what would you like to give to our viewers who are watching our show?
For our viewers, I would like to give a sincere message that, see, diabetes is not the end of life. It's very common. It's increasing rapidly. India is a diabetes capital. So what is very important is that you need to adopt a healthy lifestyle. You need to take a good amount of food. You need to include a lot of green leafy vegetables. You need to reduce the trans fat. And at the same time, a sustained level of physical activity is very much required for most of our patients, because the sustained level of physical activity will help you reduce your sugars. At the same time, whenever you have diabetes, it is also advisable that you also try to look for other diseases like hypertension, increased cholesterol, which can go hand in hand with diabetes. So if you have high cholesterol or high blood pressure, it is very much necessary that you should keep them under control. You should follow your physician on a regular basis. Whatever medications has been given to you, you should take it nicely, and do not stop any medication without the advice of your physician. Most importantly, stay safe, stay healthy, and keep smiling.
All right. Thank you so much, Doctor, for this valuable information at this point in time. And viewers, with this, we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.